You fall. It's a minor fall. You slip on the ice. You miss a step. It's the kind of fall that a younger person might laugh off. But when you hit the ground, you hear a crack, and you know immediately that something is wrong. Your hip is shattered. Your wrist is broken. Your vertebrae are fractured. What's shocking is how minor the fall was. You didn't fall from a height. You didn't have a car accident. You just fell. And yet your bones broke like they were made of glass. This happens thousands of times every single day. An older person falls from a standing height, sometimes just from stepping off a curb, and breaks their hip, breaks their wrist, breaks their spine, and their life changes forever. Many people never fully recover. They lose their independence. They move into a nursing home, and many don't live much longer after that. My name is Dr. David Miller. I've been practicing medicine for over 25 years, and one of the most heartbreaking conditions I see in my older patients is osteoporosis. Because osteoporosis is a silent disease, you don't feel it happening. You don't know you have it until your bones break. But here's what gives me hope. Osteoporosis is largely preventable. In many cases, it's even reversible. If you take action now, before your bones become brittle and fragile, you can maintain strong, healthy bones for the rest of your life. Let me explain what's happening in your bones. Your bones are living tissue. They're constantly being broken down and rebuilt. When you're young, new bone is added faster than old bone is removed. So your bone mass increases. You reach your peak bone mass around age 30. After that, bone remodeling continues, but you lose slightly more bone mass than you gain. This is where osteoporosis begins. Osteoporosis means porous bones, and that's exactly what happens. Your bones lose density. They become porous. They become weak, and they become susceptible to fractures. The risk is enormous. The National Osteoporosis Foundation estimates that 1 in 3 women over age 70 will have an osteoporotic fracture in her lifetime. For men, it's 1 in 5 over age 50. These aren't rare events. They're common, they're predictable, and most importantly, they're preventable. Let me tell you about one of my patients, Susan. Susan was 63 when she came to see me for a routine physical. She felt fine. She had no complaints. She was active. She exercised. She thought she was healthy, but I recommended a bone density test. Susan was skeptical. She said, "Why do I need that? I feel fine. My bones feel strong." But she agreed to the test. The results shocked her. Susan had osteoporosis. Her bones were significantly weaker than they should be for her age. If she fell, and most people do fall eventually, she was at very high risk of a serious fracture. Susan asked me, "How did this happen? I don't have any symptoms." I didn't know anything was wrong. And that's the tragedy of osteoporosis. It's a silent disease. You lose bone mass gradually, year after year. You don't feel it. You don't notice it. Until one day you fall, and your hip breaks. Now let me explain the biology of why this happens. As you age, several things occur. First, your body produces less of the hormones that help maintain bone density. In women, estrogen levels drop dramatically after menopause. Estrogen is crucial for bone health. When estrogen levels fall, bone loss accelerates. Second, your ability to absorb calcium decreases with age. Even if you're eating enough calcium, your intestines can't absorb it as efficiently. So calcium deficiency becomes common in older adults. Third, your kidneys become less efficient at converting vitamin D into its active form. Vitamin D is essential for calcium absorption. Without adequate vitamin D, calcium can't be absorbed, no matter how much you eat. And fourth, you're probably less active than you used to be. Exercise is crucial for bone health. When you exercise, especially weight-bearing exercise, your bones respond by getting stronger. Sedentary older adults lose bone density much faster than active ones. So you have a perfect storm: declining hormones, declining nutrient absorption, declining activity, and the result is accelerating bone loss. Now here's the good news. All of these factors are modifiable. You can't control your age. You can't fully control your hormones. But you can control your activity level. You can control your nutrition. You can control your calcium and vitamin D intake. And these things have a profound impact on bone health. Let me talk about calcium first. Calcium is the primary mineral that gives bones their strength and structure. The recommended daily intake of calcium for women over 50 is 1,200 milligrams. For men over 70, it's 1,200 milligrams. but the average older adult gets only 600 to 800 milligrams per day. The best sources of calcium are dairy products. 1 cup of milk contains about 300 milligrams of calcium. 1 cup of yogurt contains about 300 milligrams. 1 ounce of cheese contains about 200 milligrams. If you eat 3 servings of dairy per day, you'll get close to 1,000 milligrams. But not everyone tolerates dairy well. Some people are lactose intolerant. Some people are vegan. For these people, there are other sources. Dark leafy greens like kale, collard greens, and broccoli contain significant amounts of calcium. Fortified plant-based milks like soy milk and almond milk are often fortified with calcium. Canned fish with bones, like salmon and sardines, contain calcium. Nuts and seeds contain some calcium. If you can't get enough calcium from food, supplementation is important. Calcium supplements are safe and effective, but they work best when taken with vitamin D. Speaking of vitamin D, this is critical. Vitamin D is absolutely essential for bone health. It helps your intestines absorb calcium. It helps regulate calcium levels in your blood. It supports muscle function, which helps prevent falls, and it has direct effects on bone cells. The recommended intake of vitamin D for older adults is 800 to 1,000 international units per day. But many older adults are deficient in vitamin D. This is because vitamin D is produced in your skin in response to sunlight. And as you age, your skin becomes less efficient at producing vitamin D. Also, many older adults spend less time in the sun. And sunscreen, while important for preventing skin cancer, blocks the sun's rays that produce vitamin D. Studies show that vitamin D deficiency is extremely common in older adults. Some studies suggest that more than 50% of older adults have vitamin D deficiency, and this deficiency directly contributes to bone loss and increased fracture risk. The best way to optimize vitamin D is supplementation. Vitamin D3, also called cholecalciferol, is the preferred form. A dose of 800 to 2,000 international units per day is safe and effective for most older adults. And importantly, calcium and vitamin D work synergistically. They're much more effective together than either one alone. The research on this is compelling. Multiple large studies have shown that supplementation with both calcium and vitamin D reduces bone loss, increases bone density, and most importantly, reduces fracture risk. One landmark study followed older adults for 3 years. Those taking calcium and vitamin D had significantly less bone loss at the hip and spine compared to those taking placebo. Another study showed that calcium and vitamin D supplementation reduced the risk of hip fractures in elderly women who had already suffered one hip fracture. Now let me talk about exercise. Exercise is perhaps the most powerful intervention for bone health. Weight-bearing exercise, exercise where your bones have to support your body weight, directly stimulates bone formation. Your bones respond to the stress of exercise by getting stronger. The best weight-bearing exercises are walking, jogging, dancing, and climbing stairs. These activities force your bones to work against gravity. Resistance training, using weights or resistance bands, is also excellent for bone health. It builds muscle strength, which supports bones and helps prevent falls. And it directly stimulates bone formation. The research is clear. Older adults who exercise regularly have significantly better bone density than sedentary older adults. And exercise also reduces fall risk by improving balance, coordination, and muscle strength. I had another patient, Robert, who was 71 when I diagnosed him with osteoporosis. Robert was sedentary. He spent most of his time sitting. He didn't exercise. He ate poorly, and his bones reflected that. I told Robert that he had a choice. He could start an exercise program, improve his diet, take calcium and vitamin D supplements, and potentially reverse his osteoporosis. Or he could continue his current lifestyle and almost certainly suffer a fracture within the next few years. Robert decided to commit. He started walking for 30 minutes, 5 days a week. He started doing resistance training twice a week. He improved his diet, eating more dairy and leafy greens. He started taking calcium and vitamin D supplements. He quit smoking, which was also contributing to his bone loss. 3 years later, Robert had another bone density test. His bone density had improved significantly. He was no longer in the osteoporosis range. He had essentially reversed his osteoporosis through lifestyle changes alone. Now, not everyone can reverse osteoporosis with lifestyle changes. For some people, The disease is advanced enough that medication is needed. But many people can significantly slow or stop bone loss with diet, exercise, and supplementation. Let me talk about other nutrients that support bone health. Magnesium is important for bone structure. Potassium helps maintain bone mineral density. Vitamin K is involved in bone mineralization. Protein is essential. Your bones are made partly of protein, not just minerals. So adequate protein intake is crucial. In fact, the amount of protein you eat is critical for bone health. Studies show that older adults who eat adequate protein have better bone density than those who don't. Many older adults don't eat enough protein. They're afraid of eating too much meat. They think protein is bad for their kidneys. But for people with normal kidney function, adequate protein is essential for bone health. I also want to address fall prevention because falls are what cause fractures. Even with strong bones, a fall can cause a fracture if the fall is severe. So preventing falls is critical. There are multiple strategies. First, balance exercises. Tai Chi, yoga, and simple balance exercises can significantly improve balance and reduce fall risk. Second, home safety. Remove tripping hazards. Install grab bars in bathrooms. Use adequate lighting. Wear appropriate footwear. Third, vision screening. Poor vision increases fall risk, so make sure your vision is corrected. Fourth, medication review. Some medications increase fall risk by causing dizziness or affecting balance. Your doctor can review your medications and adjust them if necessary. Now let me talk about screening. How do you know if you have osteoporosis? The gold standard is a bone density test called a DXA scan. This is a simple, painless X-ray that measures bone mineral density. Based on the results, you're classified as having normal bone density, osteopenia, low bone mass, or osteoporosis. The National Osteoporosis Foundation recommends that all women aged 65 and older get a bone density test. For men, screening is recommended starting at age 70. If you have risk factors, family history of osteoporosis, smoking history, sedentary lifestyle, poor nutrition, you should be screened earlier. If you're diagnosed with osteoporosis, treatment depends on the severity and your individual risk factors. For mild to moderate osteoporosis, aggressive lifestyle changes, diet, exercise, supplementation often work well. For more advanced osteoporosis, medications may be recommended. These medications work by slowing bone loss or, in some cases, stimulating bone formation. But even with medications, calcium and vitamin D supplementation is essential. Let me give you a practical action plan. First, calculate your calcium intake. How much calcium are you eating per day? Most older adults aren't getting enough. Aim for 1,200 milligrams per day. Second, supplement with vitamin D. Take 800 to 2,000 international units per day. This is especially important if you spend little time in the sun or if you live in a northern climate where sunlight is limited in winter. Third, start exercising. Aim for 30 to 40 minutes of weight-bearing exercise 3 to 4 times per week. Include some resistance training. Even if you've been sedentary, you can start exercising. Talk to your doctor about what's appropriate for you. Fourth, quit smoking if you smoke. Smoking accelerates bone loss. It's one of the modifiable risk factors with the biggest impact on bone health. Fifth, limit alcohol. Excessive alcohol interferes with calcium absorption and damages bone. 1 drink per day for women and 2 drinks per day for men is generally considered safe. Sixth, get a bone density test. If you're over 65, talk to your doctor about screening. Early detection allows early intervention. Seventh, eat a healthy diet rich in calcium, vitamin D, magnesium, potassium, vitamin K, and protein. Eat plenty of dairy, leafy greens, fruits, vegetables, nuts, and fish. Let me tell you about another patient, Patricia. Patricia was 79 when she came to see me. She had already suffered 2 hip fractures from minor falls. She had advanced osteoporosis. She was frail. She was afraid of falling. She'd lost much of her independence. Patricia asked me, "Is it too late? Can I still improve?" I told Patricia that while we couldn't reverse all the bone loss she'd already experienced, we could stabilize her condition. We could prevent further deterioration. We could reduce her risk of future fractures. And we could potentially improve her quality of life. We started Patricia on calcium and vitamin D supplements. We got her into physical therapy to improve her balance and strength. We made her home safer. We reviewed her medications. We did everything we could to prevent another fall. 2 years later, Patricia is still active. She hasn't had another fracture. She's maintained her independence. She's living in her own home. She's grateful that we caught her condition and that she's been able to stabilize. Now here's what breaks my heart. Patricia could have prevented her fractures. If she'd been screened at 65, if she'd been counseled about bone health, if she'd been taking calcium and vitamin D, if she'd been exercising, she might never have had those fractures. Her life might be very different. Don't be Patricia. Don't wait until you've broken your hip to take your bone health seriously. Prevention is so much easier than treatment. Here's my challenge to you. If you're over 60 and you haven't had a bone density test, schedule one this month. Talk to your doctor about your bone health. Ask about calcium and vitamin D supplementation. Start exercising if you're not already. Eat a diet rich in calcium and vitamin D. Quit smoking if you smoke. Limit alcohol. Make your home safer. Protect your bones now, while you still can. Your bones are the foundation of your independence. When your bones are strong, you can do the things you love. You can play with your grandchildren. You can travel. You can be active. You can live independently. But when your bones are weak, everything changes. Your world becomes smaller. Your freedom is limited. Osteoporosis doesn't have to be your future. Strong bones are possible. You have the power to prevent this disease. Use that power. In my next video, I'm going to reveal the one nutrient that almost every senior is deficient in and why that deficiency is probably destroying your health right now. You've probably never heard of it, but it could be the most important video you watch this year. Subscribe so you don't miss it. This video is for educational and informational purposes only and is not intended as medical advice. Osteoporosis is a serious medical condition that requires professional evaluation and management. Always consult with a qualified healthcare provider before starting supplements, making significant dietary changes, or beginning an exercise program, especially if you have existing bone conditions, kidney disease, or take medications that affect bone health. Bone density testing and professional assessment are crucial for proper diagnosis and treatment recommendations.